Good afternoon, everyone. My name is Qimi Pu from Cathay General Hospital, Taipei, Taiwan. And I'm a director in the Department of Plastic Surgery. And I'm very happy to be here to present a topic about a novel macrophage regulation new drug in treating diabetic foot ulcer. And this is a phase 3 multi-regional clinical trial study, and as I will share some of my experience in using this drug in treating diabetic foot. And ON101 is this drug. It has been developed and launched for 15 years, since 2008. And this drug has completed its phase 3 MRC trial in 2020 and got the license in Taiwan and Macau in 2021, and in Singapore in this year. In 2021, the US FDA approved a fast-track designation and compassionate to use this drug for diabetic foot ulcer. Let's take a quick overview of diabetic foot ulcer. Diabetic foot ulcer is the most costly complication of diabetes, and the prevalence of diabetic foot ulcer in the United States was about 13%, which affects about 5 million persons. And 1/3 of diabetic patients will develop a foot ulcer in their lifetime. And the ulcer is often chronic and non-healing, which is the main reason leading to infection or usually amputation. But the most important thing is there is a lack of effective treatment for more than 2 decades. So an effective product for treating a diabetic foot ulcer will be able to fulfill the unmet medical need. As we know, the macrophage plays an important role in normal wound healing. In inflammatory phase, M1 macrophage is a dominant macrophage. It is a pro-inflammatory cell. But if it persists too long, it will prolong the inflammatory phase and delay the wound healing. But M2 macrophage is the dominant macrophage in the proliferation phase. It is an anti-inflammatory cell with angiogenesis process. So in normal wound healing, the M1 macrophage will transit to M2 macrophage, and leading to normal wound healing. But in diabetic wound, the M1 macrophage transit to M2 macrophage was impeded, resulting in poor wound healing. This group has published a paper about rebalancing M1 and M2 macrophages to improve the immune microenvironment of diabetic foot ulcer, and published in 2022. The ON101 can inhibit M1 macrophage, and through stimulating pre-adipocyte to secrete GSSF and CXCL3 to increase M1 to M2 macrophage transition and result in increasing wound healing. So they use ON101 to perform a randomized control phase 3 clinical trial to evaluate the efficacy and the safety of this drug for the treatment of chronic diabetic foot ulcer. And the protocol was designed following US FDA guidance for industry, chronic cutaneous ulcer, and burn wound. This drug is under IND approval by US, China, and Taiwan. And the clinical trial primary endpoint are complete wound healing and time to complete healing. And this clinical trial key inclusion criteria, including type 1 or 2 diabetes, ABI higher than 0.8, and HbA1c less than 12%, and the wound regular grade is 1 or 2. The size is between 1 to 25 centimeters squared, and have to last for at least 4 weeks, no active infection. And the patient 7 days after first screen visit, the patient will, or if the patient meets all the criteria, they will be randomized, divided into 2 groups. It is ON101 group or hydrofiber dressing group. And then the patient will come back every 2 weeks until 16 weeks, that is V10. And they will be followed up another 12 weeks to see the result. And the result of the primary endpoint of this phase 3 study is in ON101 group, the complete wound healing rate is better in ON101 group than in hydrofiber dressing group. And the time to complete healing is also better in ON101 group than in hydrofiber dressing group. And there is about 50% healing probability in ON1 treating group within 14 weeks. And in high level of HbA1c subgroup, no matter the patient is well controlled, moderate control, or poor control subgroup, the complete healing rate in ON101 group is better than hydrofiber dressing group with significant difference. And another chronic wound subgroup, no matter the wound is less than 3 months, or between 3 and 6 months, or more than 6 months, ON101 group has better complete healing rate than hydrofiber treating group. So the results shows ON101 has a superior efficacy and excellent safety in the phase 3 MRCT clinical trial. And the result was also published in JAMA Network Open. In Harvard group, they published a paper and point out for patients with intact perfusion, the topical ON101 can help diabetic foot ulcer healing. And ON101 has been analyzed in its cost effective in treating diabetic foot ulcer in Taiwan. And the ON101 with gross wound care strategy will present a good economic value than only gross wound care patient. And the result also published in JAMA Network. And next, I will show you some real-world cases from my hospital. And we conducted Fasticide, this ON101 cream for treatment of the chronic diabetic foot ulcer in Texas 1A and 1-2 patients, especially they were all has dialysis, they were all in dialysis. And the preliminary results are encouraging, but the results are not published. So I will show you some real-world cases in clinic practice. The first one is a 59-year-old female patient. She got left plantar ulcer, and she also has diabetic and hemorrhagia for more than 10 years. And the ulcer is more than 6 months after treating with multiple dressing options, but the ulcer didn't heal anyway. So we try to use the all-in-one cream. And after the first week, the wound became more granulated and more superficial, and the wound size is decreasing. In another 3 weeks, after the fourth week treatment, the wound smaller than before. And one more week, the result is obvious. Another week, and after 12 weeks after the first treatment, the wound healed completely. And in case number 2, this is a 75-year-old male patient. He got his left plantar ulcer for more than 6 months, and treatment with multiple modality, but in vain. And he also has diabetes and received dialysis. So we try to use the ON101 cream to treat the ulcer. After 2-week treatment, the ulcer healed completely. We use this ON101 cream not only in diabetic ulcer, but also in pressure injury chronic wound patient. This is a 71-year-old female patient. She has a sacral pressure injury, stage 3, in his sacral area. And she also is a victim of colon cancer patient. After debridement and remove some necrotic tissue, with ordinary dressing, after 1 month, the sacral pressure injury didn't get much improved. So we tried to use the ON101 cream. After 1 month, the sacral pressure injury size is decreasing. And another 5 weeks, the wound decreased, and until 11 weeks after the first treatment, the wound almost healed completely. And the last case also is a pressure injury patient. She is a 58 patient, and she is a paralytic, and she got left pretibia and left foot pressure injury for a long time. So we try to use the ON101 cream to treat these 2 also. After 3 weeks, the pretibia wound became more granulated and more superficial, and also in the left foot. Another 1 month, we can see the re-epithelialization became more obvious and more granulated, and left foot ulcer is also getting much improved. So in conclusion, the ON101 cream is a novel macrophage regulation new drug in treating diabetic foot ulcer, and it shows better results in phase 3 MRCT study and hydrofibrillation. Now we use the Fespisone cream to treat chronic ulcer, including uremia patient with diabetic foot ulcer and grade 3 pressure injury. Now with encouraging results in clinic cases. Thank you for your listening.